Handbook Orientation. Now, this is not going to take you through every little thing that you need to know from the handbook. It's just going to pull out some of the more important information, but understand that there's going to be some information that is not covered in this presentation that you will be responsible for knowing. So don't use this as a substitute for not reading the handbook. Excuse me. So we talk about attendance in the didactic portion of the class. And if you are going to be attending classes on campus, you cannot miss more than 20% of that class meeting time. Otherwise, it will result in failure. If you are coming in late or leaving early, this time adds up and it will also count towards absence. And again, you can't miss more than 20%. Late work. So with any of your coursework or any of your take-home exams, etc., you have a due date. And if your work is not turned in by the due date, then in most cases it will not be accepted. You will have some instructors that will accept if you communicate with them that you have some issue that has come up that has not allowed you to complete your work on time. However, this is why we also encourage you to not procrastinate and put your assignments off to the last minute. And because life happens and sometimes things come up that will prevent you from completing an assignment on time. So do not procrastinate, but always communicate with your instructor if you have some type of an issue. It may go in your favor, it may not. You are going to be expected to attend all simulation sessions. If you do have an absence, then you will have to make this simulation up at the end of the course. So make sure that you are always, if you have an absence or a tardy, that you are notifying the faculty yourself. Do not contact your classmate and say, would you please tell Ms. Taylor that I'm not going to be available at, or I'm not going to be present at class. That doesn't count. That doesn't work. That would be considered a non-notification. So make sure that you are personally notifying the instructor yourself. You don't leave it up to classmates. We do have several rules for our simulation, and first of all, our mannequins are clients. We treat them just like a patient. We treat them with respect. We are not making fun of them. We are not treating them in a way that would cause harm, etc. We also um, encourage client privacy, confidentiality, and safety with our mannequins. And ink, pens, markers, or betadine are not to be used anywhere around the mannequins. As far as clinicals, there's some clinical sites that do orientation prior to the start of the semester, and students need to be available for those clinical orientations. It cannot be rescheduled, it cannot be made up, so do not schedule anything around a required orientation. Attendance at clinicals is outlined very clearly within the handbook. You cannot miss clinical. If you miss clinical, you have to make it up. If you miss too many clinicals, then you fail the program. And if you fail or you fail that course, If you fail a clinical that is associated with a didactic course, which they all are, then if you come back into the program, you have to redo both the didactic portion and the clinical portion. You can't just do one of them. Again, more information on the attendance of the clinical sites. You will have to do a makeup assignment. You may have to do a written paper, and you may be dismissed from the program. Any student that is excused from a clinical setting because of behavior or professionalism issues, and they are not allowed to return to that facility because of what they did, they are going to fail the clinical and the course. We do not set the number of hours for students to have to complete for each course. This is set by the state, and you have to complete it. It's not negotiable. It is not something that the college makes up. Again, this is a state requirement. Snow days, whether it is going to be class time, simulation, or clinical, um, we do post snow days on the local TV, uh, whether it's a text alert, it may also be on a radio station that will announce cancellations or delays. You may also get an email when that has been decided. So if it's a didactic class, it's canceled. Uh, we as instructors can provide some recordings or readings or other resources to help cover the material that may be missed. And it will be up to the student to learn that material and reach out to the instructor if there's any questions. If it's a clinical that's missed, then you will have to make up that time. There's no other way about it. If it's a simulation that's missed, you may do a makeup day or you may do a virtual session. It depends on the instructor. And if it is virtual, then you do have to be in clinical attire for the session, and you have to be on camera for that session. Excuse me. For a holiday, if it is a holiday for a class period, then it's a holiday. We don't do anything. Excuse me. If it's for a clinical, then we still have to reach the required amount of clinical hours. However, it can be done in a variety of ways. Some instructors will add time to the clinical day to make up that time missed. Some instructors will schedule an extra day, and it may be that you make up the clinical at the end of the semester. So a variety of things. Your instructor will let you know how that time will be made up. Course failure is going to be defined as for the PN group. First of all, and this goes for ADN also, we always look at the exam average. For the PNs, the first 8 weeks, the average that you have to obtain is a 74%. If you get that 74% on the exam average, then we figure in the rest of your coursework. And if that coursework is less than 76%, and this does include your exam average, then you would fail based on coursework average. But we always look at the exam average first. For PNs, after the first 8 weeks, we bump that up to 76% exam average and course average. For the ADNs, this is an exam average of 78%. If you do not hit that 78%, then you have failed the course. If you do hit the 78%, then we add in all of your coursework points. And unfortunately, we have had to fail students who have had a passing exam average, but they have not had a passing comprehensive or course average. So make sure that you complete all of your assignments. And if you miss greater than 20% of any scheduled class time, then that can result in course failure. With your labs, for first semester PN and first semester ADN, you do have to purchase skills bags. These bags are purchased from the bookstore. The PNs will receive a red bag for their fundamentals or foundation skills lab. They will receive a black bag for IV therapy, which will be the second 8 weeks. The ADNs will receive a blue bag, and then when they are going to do IV therapy, which is in the second semester, then they will also be required to purchase that black IV bag. It is going to be up to the students to make sure that everything is in the kits. When the kits are put together, sometimes something may be left out or something may be damaged. And it will be up to the student to make sure that they return that to the bookstore to get a replacement. And this needs to be done prior to any labs beginning. Do not, and I repeat, do not open anything inside the skills bags. Don't open any packages, etc., until your instructor tells you to do so. We do have several guidelines. You are going to be expected to help maintain the cleanliness and order of the labs. You have to make sure that everything stays clean, that the beds are made, that trash is picked up, etc. Realize that any medications that may be included in your skills lab bags are educational use only. They're not really medications. They should not be consumed. Excuse me. You, as a student, are not allowed to be in the skills lab without an instructor or faculty supervision. You should not perform any task without first receiving direction from the instructor. Again, do not open anything in your bag without instructor permission, and do not do anything without instructor direction. There are some different things that can help you be successful, and I highly recommend that you read through all of these. But one thing that I really want to point out is that you, as the student, have to accept responsibility for your own actions. You need to accept the consequences of your actions, and If your behavior falls outside of the behavior that's outlined in the standards, you need to accept the responsibility for it. We as instructors can provide you with guidance, we can provide you with the tools for success, but we cannot make you follow them. Um, that's going to be up to you. If you fail a test, it's not the instructor's fault. If you are unsuccessful on a skill, it's not because of the instructor. It's not because of your classmate. It's not because of uh, something else that may have occurred in your life. It is because of you. You need to be accountable for all of the information, for all of the skills, uh, for your success. If you have issues understanding something, if you don't reach out to the instructor, again, that's on you. The instructor is there to guide you and to help you along this trek. We're going to try and help you be as successful as you possibly can, but we can only do so much. You have to practice, you have to study, you have to complete the assignments, etc. We also encourage you to listen to and learn from the constructive criticism that we give. Let's say after a simulation or after a clinical skill or something in the lab. We're not doing it to prove how smart we are. We're doing it to help you become successful, to help you learn how to do things the right way, to help you get better. And we can't do that without providing some constructive criticism. So please don't take it personally. Just understand where we're coming from. This is what we're paid to do. Make sure that you check your email every day, your school email, for any messages from your teachers and your classmates. If you do not read your emails and you miss some important information, it's not because it was not provided. Make sure that you do not visit your social network, your personal email during class, clinical, or any type of clinical or lab situation. We do encourage you to attend open lab at least twice each semester to practice and review skills. Again, if you're not doing these skills, then you are not going to be very practiced at them. You're not going to be very competent at them. You need to practice, practice, practice as much as you possibly can in order to develop that muscle memory and in order to become proficient at completion of these skills. We also recommend that you develop a group of peers to study together. Sometimes working in a group for studying or practicing skills helps hold each other accountable. You can make sure that you're learning all the material that you need to. One person may have heard the instructor say something that the other person did not. But when you're studying in groups, then you can pool all of that knowledge together. But lastly, and probably most importantly, understand that everybody is capable of completing this nursing program if they appropriately apply themselves and reach out, use their resources, practice, study, etc. Additional suggestions: employment can be a significant issue. People have to work, students have to work in order to support themselves, to pay the bills. We do encourage you strongly to not work more than 20 hours a week. Your nursing program literally is a full-time job. It is a full-time job. It requires a lot of studying, a lot of work, a lot of your time, a lot of your attention. And if you are working more than 20 hours a week, this can actually cause a deficit in your class scores, your skills, etc. It could also cause harm to clients, especially if you work the night before a clinical. So we also encourage you do not work the night before a clinical. We also encourage you don't work the night before a test because your brain is not going to be functioning at its optimal capacity if you are sleep deprived and ready to fall into bed and get your required sleep hours. We also encourage you do not schedule anything life shattering, any major celebrations during the school year. When you miss school, you miss a clinical, you miss a lab, etc., because you choose to be somewhere else, then you are putting your success in the program at risk. For example, during an 8-week clinical, you can only miss one clinical. You have to make it up, but you can only miss one. And if you miss that one clinical because I want to go do this instead of attending my clinical, then what happens when you get sick? You have nausea, vomiting, diarrhea, and you're unable to attend a subsequent clinical. Well, then you're out of the program. So it's very important that you do not schedule anything major during the school year unless it's during a break period. Testing policy. So tests, we've already kind of discussed some of the requirements. You have to have, for the ADN program, a test average of 78%. And then you have to have that 78% course average after the successful exam average. Practical nursing students, you have to have a 74% for the first 8 weeks, and this is only for KSPN 102 and KSPN 115. After that, you have to have a 76%, and you have to have a 76% on the overall course average throughout the entire program. You also have to pass all of your clinicals, which is hard to not pass these. If you do what you're supposed to do and complete your paperwork, turn it in on time, you will pass your clinicals. With your simulation, same thing. It's very difficult to not pass it unless you are just doing everything wrong. Excuse me. We do not round final grades. So even if you have a 77.99% in the ADN program, you have not successfully met that 78%. We do not round up. For those students who score less than an 80%, and it doesn't matter if you're in the PN program or the ADN program, if you score less than an 80% on any of your modular exams, you are required to do some exam-specific remediation as assigned by the instructor. So it will look different for every instructor. And it's the student's responsibility to complete that remediation assignment by the deadline that's assigned by the instructor. So the instructor says it's due on Monday. That doesn't mean that you can turn it in on Tuesday. Failure to do so can result in course failure. In addition to less than that 80%, you not only have to complete that remediation assignment, you also have to make an appointment with the instructor and meet with the instructor one-on-one. And you have to attend the student success sessions. This is all part of the testing policy. So 3 things if you score less than 80%. You are required to do the remediation assignment. You are required to attend an appointment with the instructor. You are required to attend the student success sessions. If you do not do these, then that can result in course failure. It can also result in an assignment that is provided by the instructor. And if you do not complete any of these, again, course failure. So just do what you need to do and understand that it's all for your benefit. We're not punishing anyone. It's to help you gain a deeper understanding of the material that you were unsuccessful with. Again, a C is the passing exam score. For the first 8 weeks of the PN program, that will be the 74 to 81%. For the remainder of the PN program, it's 76 to 81%. For the ADN program, it's 78 to 81% to achieve that C. I don't want students to get all concerned about letter grades. When we're talking about NCLEX, which is your exam to receive your license, it's a national exam. If you don't pass, they're not giving you a D. If you pass, they're not giving you an A, B, or C. So understand it's not about the grade so much as about pass or fail. That's going to be the most important thing. So please make sure that you don't get so focused on the grade that it overwhelms you and can cause some um, mental issues regarding whether you're able to do this or not. Excuse me. So don't get so focused on the grade. Be happy if you pass. It's great to have a higher grade just because it gives you a little bit of wiggle room, but don't be bummed out if you get a C and you thought you would have had an A, etc. You passed, and that's what's most important. Okay, so all exams need to be taken at the time that they're scheduled, unless you arrange it previously with the instructor. And if you have to do a makeup test because you were not available on that day, that makeup exam can be in a different format. It can also have different questions. It would still be over the same content, but it would not be the same as what the rest of the class took. You may have essay questions, etc., or fill in the blank questions. You are expected to arrive in class early enough to begin the test at the start. So if we are starting the exam at 9 a.m., that does not mean walk in the door at 9 a.m. because you will not be ready to take the exam at 9 a.m. If you are taking the exam at 9 a.m., you should be arriving about 8:45 or 8:50. So as soon as that door is opened, then you're able to walk in, get your computer, get your material, and be ready to start the exam at 9 a.m. If you arrive to the exam greater than 10 minutes late after the start of the exam, You may not be allowed to take the exam unless you have made previous arrangements and notification with the instructor. So it's very important to be on time. Students are not allowed to take notes or audio recordings or video recordings with any exam review. Test integrity is very important. Students that students that talk about the test after they've taken it, if the rest of their cohort has not taken the exam, if they are talking about it with those students, or the students who have not taken the exam are talking to students who have already taken the exam, etc., then that's considered cheating, and it can result in course failure if you are caught doing this. So very important that you do not discuss the test outside of class. Very important. Um, all scrap paper will be kept with the instructor. You should not take any scrap paper outside of the room with you. And we provide everything. Something else that you need to be aware of is you will not be allowed to wear hoodies. You're not allowed to wear jackets or hats or smartwatches during an exam. So these classrooms are often cold, so I recommend wearing a sweatshirt so you don't have to take off a hoodie and just have a camisole underneath it. So make sure that you are dressing appropriately for all of your exams. Phones are not to be allowed at the desk during testing, nor is any of your class material allowed. We recommend that you just keep it in your car. You don't need it in the classroom anyway. If you do feel that you need to bring it in, then you need to place all of your belongings at the edges of the classroom. You are going to have a variety of questions on your exams. You will have some dosage calculation questions on every exam. You're going to have select all that apply questions. Some of them will receive partial credit, some of them will not, and your instructors will discuss that with you. Again, some student success suggestions, and these are responsibilities of the student. You need to plan at least 3 hours a week for every hour of class time. Making sure that you arrive on time, and the saying is that if you arrive on time, then you're late. So plan to arrive 10 to 15 minutes early. Please, please, please pay attention to this. Making sure that you are going through every assigned reading or lecture or electronic resource within Blackboard prior to scheduled class time or simulation time or clinical lab time in order to make sure that you're prepared. Remember, in nursing school, and this is probably one of the most important things I can tell you, forget how you do things at your work site. Forget what you've seen at your work site, because we're not testing you on those things. We're testing you on what you learned within the school itself from the textbook. NCLEX is not going to test you on how you do things at your place of employment. It's going to test you over the material that your instructors are giving you.